Alrighty, and we are recording now.
Okay, perfect. All right, guys, this is your final exam review. And the general topics on the final are listed here. So this means that there is at least for each of these general topics. So we have depression and anxiety, we have personality disorders, including borderline personality disorder and narcissistic personality disorder specifically. We have schizophrenia, bipolar disorder, substance abuse, trauma, geriatric depression and older adult abuse, dementia, eating disorders, and of course, medications. Okay, so a quick review on depression and anxiety. So always remember suicide assessment is a priority. I wonder if my chat is getting into the recording, so I'll close that out. Um, know that we have major depressive disorder, persistent depressive disorder, and a variety of anxiety disorder types. You could just go through your notes and hit each one of those. You don't need to go in depth for that. No somatic disorder. Somatic disorder has an etiology from an existing anxiety disorder. So these people tend to channel their anxiety into perceived things that they feel are physically going wrong with themselves. So they tend to think that they have, like a heart condition or anything going wrong with the body, basically, but it's stemming from their anxiety. There's not actually anything physically wrong with them. So, what type of medications are commonly used to treat depression? Go ahead and throw it up in the chat. The most common one. What are they saying? Could you field the chat for me, Charisse? Oh, you're muted, girl.
So thank you. So SSRIs are coming up in the chat.
Yep.
Someone mentioned Zoloft in particular. Prozac is coming up.
So SSRIs, yeah, any of them. Those are
Great
like the
job.
main go-tos, and then there's the SNRIs and the other ones, but SSRIs are definitely the first go-to, right? They're kind of like the gold standard. So what do we want to teach patients who are taking MAOIs, which SSRIs didn't work, SNRIs aren't working, so they're put on an MAOI. What do we want to teach them about MAOIs?
So somebody's mentioning tyramine restriction. Don't eat aged foods. Avoid foods with tyramine. Don't eat like an Italian. No wine or chocolate. No wine.
Yeah, totally. Don't eat like an Italian. Totally, 100%. So like those aged meats and wine, red wine, you want to avoid. You want to avoid chocolate, cheese. Yes, Italian. Think that.
I like that. I like that a lot. I'm gonna remember
It
that.
100% pizza, like all of that. Avoid timing rich foods for sure. What will happen if they end up eating something that has high tyramine amounts in it while taking an MAOI?
So in the chat, they're mentioning hypertensive crisis, high
Hypertensive
BP.
crisis. Yeah,
You
good
guys got
job.
it.
Okay, Sharice, you want to go ahead and take this one?
Sure. So we have borderline personality disorder. And when we talked about this last time, Natalie mentioned the Greek story of Narcissus. So I always think of, this story really sticks in my mind, just like the whole mirror concept. So like, just thinking about when I think of narcissistic personality disorder, just that inflated sense of self, thinking they're really egotistical in a way. So remember that. And then also with BPD, remember that the main characteristic is going to be the splitting and manipulative behavior. And our nursing priority is going to be assessing for suicidal and self-mutilating behavior. What are some other treatments that we have for people with BPD, guys? So in the chat, somebody mentioned DBT, great. CBT, great for setting firm limits. Yeah, you guys got it.
Good job. Okay. Schizophrenia. So the diagnostic criteria for schizophrenia is that they need to have at least one psychotic symptom, so either delusions, hallucinations. You never want to negate the symptoms that they experience, even though we know that people don't hear voices naturally. They are still very real to these patients. So again, you guys, this is all just a review. So it should just be refreshing your memory. You shouldn't have to be like jotting notes down. Maybe with the ones that are going to be newly introduced, like geriatric depression and stuff like that, you might want to take a couple notes. But just go through this with a review. So medications for schizophrenia. You have your antipsychotics. That's like the primary medication that is used to treat delusional thoughts and hallucinations. You know these three drugs. You have Zyprexa, and know the little notes that I put under each of them. So a pro of Zyprexa, it's a newer antipsychotic, right? So it's going to have the reduced risk of those extrapyramidal symptoms. But unfortunately, it does may cause weight gain. With clozapine, know your clausural registry, right? So know that a side effect with clozapine may be the agranulocytosis, which could put them at risk for infections. With Haldol, know that one of the adverse effects is neuroleptic malignant syndrome. So when we have patients taking antipsychotics, we want to be sure to assess them accurately. We use the AIM scale. And what is that used to detect, you guys? Are they saying anything in the chat?
Not yet. They might be. Oh, there we go. Abnormal muscle movement, abnormal movement.
What is that called? You might see commercials for it in here.
Tardive dyskinesia, question mark?
Tardive
TD.
dyskinesia. Yeah, TD. So you'll see that in a lot of commercials for drugs. I'm such a nerd. Like I'll be listening and like listening to the side effects, and
I do that too.
Tardive dyskinesia. There it is. Okay. You want to go ahead and take bipolar?
Sure. So with bipolar disorder, suicide is a serious risk. So remember that you always want to assess for suicidality. Main characteristic is going to be that grandiosity and mania. You're typically going to see the grandiosity in a lot of these situations where they have the way the questions are structured. And then remember, just with mania, a lot of times that's why these patients sometimes go off their medications because they like that manic state. Also, their physiological needs, guys. So remember, we need to make that our first priority because when they're in that manic state, remember, they're not really sleeping, they're not eating. Like we want to have, finger foods available, things that are easy for them to eat. So remember things like that, your nursing priorities. Okay. So what electrolyte is lithium going to affect? What do we want to check the labs for? Sodium. You guys got it.
Good job.
And what are we going to teach our patients regarding their sodium intake? Keep it the same. Don't change it.
Exactly.
Maintain it. Yep. Mm-hmm.
Yep. And then the last thing I want to say is just know your Maslow's hierarchy of needs, right? The physiological needs is at the bottom. That's your foundation. You cannot build anybody up or anything up like a house. It needs its foundation. That is the first thing that they need when they come in. They need to have that addressed as their physiological needs
those
first
needs
above anything else.
Need to be satisfied first. So you breathing, food, water, sleep, all those things, basic needs, satisfy those first. So that's your priority.
Good job. Okay, so substance abuse in particular, this one is for opioids. So ABCs are a priority, coming back to those physiological needs, right? We want to make sure that we're looking at the vital parameters and the goals with people who have been on opioids or they're maybe like they came in and they were ODing. So blood pressure, we want to keep blood pressure above 90/60. We want to keep the heart rate between 60 and 100, and we want to keep the respiratory rate between 12 and 20. You guys definitely need to have these down. So just make sure if you see anything that's like out of normal at any point, yeah, you need to address that. So assessment for opioid withdrawal is going to be your COW scale, right? And then treatment, if we have someone who is ODing from opioids, is going to be Narcan, naloxone, and it is available in injectable or nasal spray forms. And Trace, you want to take substance abuse with alcohol?
So with alcohol, I know you guys know this stuff, but remember that withdrawal can be life-threatening. So first question we want to ask, when was your last drink? And DT, delirium tremens, that rapid onset of confusion, is the most severe form of alcohol withdrawal, and it's our priority to assess and try to prevent this. It causes hallucinations and seizures, big one. So signs and symptoms of alcohol withdrawal are going to be those tremors. They're going to have an increase in their blood pressure, and they're going to have a bounding elevated pulse. And these patients will have defense mechanisms. So they're going to be in denial, project, use rationalization and introjection. So think about when you're communicating with these patients, how you want to communicate with them, okay? But really important, and I know you guys know this, is assessing for DT and for seizures, preventing seizures.
Know these defense mechanisms, know the differences between them. Introduction, not so much with people who have substance abuse with alcohol, but you could definitely commonly see denial, projection. They're taking their own feelings, they're projecting it onto others, and then rationalization. They're rationalizing why they're drinking, right? Yeah, good job.
Yeah, so just know the differences.
So the harm reduction model, this is just a really cool image that I found on it. But can you guys give an example that's like very near and dear to San Francisco here that would be an example of the harm reduction model?
Give it a minute in case you guys are typing. So they have the so the needle exchange program.
Yes. Yes, exactly. The needle exchange program was promoted and thought up of because it reduces basically the spread of HIV and AIDS, right? So it's reducing harm, and there's all different harm reduction models out there. But basically, the aim is they're trying to do it in a way that is non-judgmental, and providing, resources for patients, basically.
Correct me if I'm wrong, Natalie, but isn't there also like a safe injection program that they were trying to do in San Francisco? Would that also be an example of a harm reduction model?
Yes.
Okay.
Yeah,
Cool. I just wanted to
absolutely.
throw
Like
that
you're
out there.
saying for them to use.
Correct. I don't know if you remember a while back, there was on the news where there was safe injection areas for patients to
Absolutely. That is totally 100%
pink
like
needles, and they had
harm reduction,
infection.
yeah,
Yeah.
efforts. Yeah, because it's preventing the spread of disease, and that's the whole point. Model. It's non-judgmental. It's there to prevent further damage to society, basically. Good job.
Right. And somebody in the chat just mentioned
Okay,
or
so
not blowing out their own veins, which is true.
wait, what did you say?
Somebody in the chat mentioned or not blowing out their own veins.
Their own veins. Oh, yeah. Okay, so geriatric depression and older adult abuse. I just added Johnny Cash in here and a quote from the song Hurt. If anyone is familiar with Johnny Cash, he had a lot of demons in his own life. And sadly, he died. I remember the day he died. It was in 7th grade, and I remember I was so sad. I love Johnny Cash. But he died from diabetic complications, but he also died like 4 months after June. And, some people say that he died of a broken heart. So maybe, which, if he totally negated his treatment for diabetes, could be the case. But we always want to, with older adults, they are losing people. People are moving on, whether, whatever your beliefs are, to the afterlife or whatnot. Family members are going, and often they don't have anyone left. And so we want to carefully, go through and assess older adults for depression. And we use the geriatric depression scale to do this. It's a self-report questionnaire style yes/no format to assess for depression in older adults. And some signs and symptoms to watch for are either a low or sad mood. And again, with anyone, it is a priority to assess suicide ideation, right? Okay, Therese, you want to go ahead and take this one?
Sure. Excuse me. So, older adult abuse. We want to always, always, always assess our elderly patients for this. So, it can be in various forms. There is physical abuse, which can be seen, by like bruises, repeated injuries, and bones that are in different stages of healing. Also, emotional abuse. Financial exploitation, that's a huge one where a lot of elderly patients are being cared for by their children or maybe their children-in-laws, and they're receiving some type of government assistance or financial assistance, and they may not actually be using the money for them. So you may see neglect, signs of neglect, such as poor nutrition, poor hygiene. Also, sexual abuse and abandonment are all forms of elderly abuse that we want to assess for. And let me just look
Good
at the
job.
chat
Yeah.
here.
Yeah, if you could fill the chat, because I'm worried that if I bring up the chat, it gets caught up in the recording.
It's actually in my recording because I'm the one who's recording it.
Oh, okay.
Yeah.
Okay, so I can open it. Okay.
Mhm.
Sorry.
No worries.
So you guys, is anyone familiar with the picture that I have here? It's yeah, someone said that movie was insane. So yeah, it's a super like over glorified, kind of fictitious representative of financial exploitation. I Care a Lot. Yeah, it was a Netflix movie that was released not too long ago, and but it addresses financial exploitation in older adults, which is a very real thing. Like Shuri said, it's a big problem, and often, sadly, it's family members that are doing it. It's whether it be a granddaughter or grandson or even daughter, son, whatnot. We want to make sure that we're addressing this. And can we go back one more slide? Right? Yeah, of course. Let me see if I can do that. Hang on. It's not giving me the...
I think if you hover like kind of to the bottom left.
There we go.
Oh, there you go.
That one. Just make sure that's the right one. Okay. Yeah, no problem, Rosa. Okay, so back to this. Yeah, so it was a good movie, but yeah, a little bit fictitious, but it was done well. And just know that the financial exploitation is definitely one of the ones that like people are surprised about when they learn about it in nursing school, but it is a huge thing. But any of these can be happening with older adults, and we always want to make sure that we're assessing to see if there's any risk of that. And what would put them at risk? Dementia. There's 4 primary types of dementia to know. I think there's like about 10 different types of dementia, but these are the primary. So you have Alzheimer's, right? You have vascular dementia, you have Lewy body dementia, and you have frontotemporal dementia. And just know that older adults that suffer from dementia are at even more risk for older adult abuse. They kind of correlate to each other, and we need to assess for those signs, right? Okay, eating disorders. You want to take this, Sharice?
Sure. So we have anorexia and bulimia, which I'm sure you guys are familiar with the definitions of the terms, but this is just breaking it down by body system. So we know as we're, doing our head to toe assessment or we're getting our labs, these are all the things that we want to be aware on the lookout for, essentially. So they're going to have thin hair. It's going to be brittle. Psychologically, they're going to be afraid of gaining weight. They're going to be sad and moody. Literally, they will be so turned off and freaked out by food. They're like, I cannot have this anywhere near me. So it's just really that irrational kind of sense of kind of irrational fear of food, rather. Also, fainting is another sign we can assess for. On the other hand, with bulimia, they have again, it's a fear of gaining weight. They have anxiety and dizziness, so these are kind of similar things. So try to focus on the key things that are different in these situations. So I had a good example in my notes here.
You guys are welcome to take a screenshot of this too. They're really good little charts that I found showing the different. You don't need to memorize this, by the way. The one thing I do want you guys to know is that with bulimia, they're going to have dental deterioration from acidic emesis.
Yes, that's what I was
They're
exactly going to say. Yes.
they're going to have electrolyte imbalances in both, but they're going to have dehydration mainly with bulimia because they're vomiting, right?
Mhm.
And bulimia, isn't bulimia also, there might not be the weight loss, right?
Yeah, you are correct. Sometimes there's not like a significant weight loss that you might see with anorexia. I actually did have an anorexic patient, and yeah, they definitely have more of that. Like they're not getting the nutrients in their body, so their hair is super thin. It's falling out. It's brittle. They're super super thin. You can see they're like like a skeleton. There's no fat at all, and they won't eat.
And you, when you see them also, like, you may have a patient who's young, like my patient who was anorexic I had was super young, beautiful, but she looked so aged because of how it was affecting her
Yes.
body. So that's another thing too.
Yeah, they'll have like sunken eyes. I totally agree, like the aging aspect that you see, because they're not getting nutrients. Yeah. But just know when they're purging, they're going to have, because of that acidic emesis, dental deterioration, and they're going to have more dehydration.
Yeah.
Good job, you guys. That's it. Super
gonna-
straightforward, but that is like what your exam is going to look like as well. And then now we have our practice questions.
Yeah.
So,
I'm gonna
Cherise, you can go ahead and stop recording.
Yeah.